we have another presentation. I think we've got people going on at 4 o'clock, correct?
Hi, thank you for joining us today at our community.
I'll skip my 4 o'clock if people can stay.
This is Tracy Truelove. I'm one of the public information officers on the COVID response for Pitkin County and Aspen. Today joining me, I've got Dave Ressler of Aspen Valley Hospital, the CEO of Aspen Valley Hospital, and Charlie Strickert, who's one of the Pitkin County Health epidemiologists. And we know a lot of you have been really interested in the data, and there's a lot of it. And one of the things that we're excited that we're going to be able to roll out next Tuesday to you is a new website platform where a lot of that information and data is going to live, and it's going to be updated more frequently, and so you can really track on where we're at and what we've been up to. But today we're going to have this team start with kind of the data presentation. And then closing us today will be Mayor Tory with the City of Aspen, who really wants to share with you just thoughts around how we really are in all of us are in this together. So with that said, Dave, I'm going to go ahead and kick it over to you.
Great. Good afternoon. Thank you, Tracy. Once again, I'm Dave Ressler. I'm the CEO of Aspen Valley Hospital. And I am going to share my screen because I have some slides to walk through that might be helpful for explanation purposes. And the first point I want to make is the effort that I'm going to undertake today is to be able to provide you with some information about Aspen Valley Hospital, our current status, our capacity, and the status of our testing, all within the context of the roadmap to reopening that we are all watching very closely. And there's a Board of Health meeting going on right now talking about the next phases for reopening. So this is topical and timely. So let me just review, first of all, overall, what it is we're trying to accomplish and what the county, our partner, is working to accomplish with the support of our community. And let me just point out a few overarching themes. First of all, as we've said on these calls multiple times, the community has done its job. We have effectively and aggressively reduced the incidence of the virus. And I'm going to show you some data that will reaffirm that. And that's why we're in a position now to be moving forward with the roadmap. Number two, we have to remember, though, and we've had our physicians on time and again telling us that COVID-19 remains a serious threat to all of us. And it isn't just those that are elderly and vulnerable, even though that is the vast majority of those that are impacted the most significantly. It affects all of us. And it is a very serious virus, and it isn't something we can just let run its course. And we are going to be living with this for months and likely years to come. So we have to become adept at what it takes to continue to protect ourselves and our community. However, having said that, we cannot stay in a suppressed mode. We are already seeing the secondary adverse impacts associated with that on our mental health, certainly on our economy, on our jobs, on our incomes, on our ability to support our families. We have food insecurity. We have all sorts of repercussions that are called adverse determinants of health that we need to be aware of and combating. But the best thing we can do is to open our communities safely. And that plan is the roadmap to reopening. So with that in mind, this is the roadmap itself. It is our path forward. I want to focus right in the middle there on the 5 criteria that must be met to move to the next phase. And I'm going to spend some time talking about these, and Charlie's going to talk in greater detail about the testing and tracing part of it. But just as a reminder, these are the 5 criteria. And so the first one is we have to continue to see the sustained decrease in number of cases, which we are. We have to be able to safely treat all of our patients. A lot of what's been happening across the state and the country is to ensure that the healthcare delivery system is able to meet the healthcare needs of the community and have the capacity to do so by not being overwhelmed by COVID patients. We have to continue to test for patients with symptoms, and that's what we've been doing at Aspen Valley Hospital. We've now been providing that for a couple of weeks, free of charge to the patients, to bring everybody in that has COVID symptoms, as referred by the primary care physician. Number 4, be active and timely in monitoring all of the cases. That's the tracing process, contact tracing process that Charlie's going to speak to as well. And then finally, we all have to do our part as community members to adhere to the social distancing and the hygiene requirements that are otherwise known as the 5 commitments of containment. So first of all, starting with the first one, that Pitkin County sees a sustained decrease in the number of new COVID-19 cases for 19 days, or for 14 days. This is a chart that is representative of the number of patients that we've been testing in our emergency department for COVID-19. In other words, those that have presented with COVID symptoms. Not all of these, actually a very relatively small number of these, percentage of these, as we'll talk about later, were positive. But you can see that ever since about the first part of April 11th or 12th, we really had a fairly sustained, albeit variable, level of demand on our emergency department by patients that felt like they had symptoms. During that time, we intubated and transferred 4 patients. We had 2 patients in the community that died. But since around the beginning of April, approaching now the middle of April, we've really had a fairly sustained period where we've had relatively low levels of activity on a daily basis, between 0 and 2 patients at a time. Looking at the same data just a little bit differently on a weekly basis, you can see the linear regression line in green showing a very clear decline in the number of cases coming to the emergency department. It does appear that during the last 2-week period, we had an uptick, but that actually is not a function of more patients presenting with COVID symptoms. We, in our emergency department, just started testing more of our patients when we are concerned they may be complicated by COVID. So, for example, we had a heart attack patient that we just wanted to make sure they didn't have COVID at the same time we were trying to manage that condition. So that's actually the reason for the uptick within the past couple weeks. So that decline is the first thing we needed to see when talking about moving forward. This, too, demonstrates that we've actually had a small number of patients in the hospital that have been admitted, both with COVID-positive test results and those that we call persons under investigation, or PUI, for COVID, where we're waiting for test results, what have you. As you can see, we only listed those dates where we had at least 1 patient. All of the other dates not listed on the x-axis there, we didn't have any at all. And you can see every now, we had one time where we hit 3, a couple times we had 2 patients, but for the most part, we've had about 1 patient a day in the hospital consistently. In our respiratory tent, where we invite physicians to refer patients for evaluation and testing when it's appropriate, you can see there as well that we've had a pretty variable amount of demand on our tent since 24th of March when we opened it. But again, if you look at the green line, that's a linear regression line that shows a general steady decline in the numbers. And then in terms of those that have been referred to the tent ever since we opened on April 25th, just for testing. So this is where we're trying to support the testing and tracing process, and our community physicians have referred our patients to the tent just for a test. And as you can see, the last couple of weeks, we've had an uptick. You can see the weekends we drop off. But during the weekdays, we've had a pretty steady number of patients that have been coming through the tent just for that purpose, to receive their COVID test. And finally, this is probably one of the most important indicators. We're going to talk about this a little bit more in a minute. This is the percentage of our staff, total staff at ADH, that had been out ill with COVID-like symptoms. And you can really see that it ramped up there in March and then dropped off towards the end of April. We were up to as high as 6.5% of our employees at one time were out. And now at any given time, we just have 2 or 3 employees that are out with really any type of illness. our employees we have a full workforce ready to go to work for our community. So the second point that we talked about earlier, the criteria that have to be met, is that our hospital has to be able to safely take care of all of our patients without having to be in a crisis mode. So this is now a matrix that we're going to be presenting to the community and to all of us that have an interest in what's happening at the hospital as an indication of the amount of capacity that we have at any given time, because this is one of those 5 key criteria. In the past, we've been reporting, and Tracy mentioned that we're going to have a more robust reporting on the website, the actual number of patients that we've had in the hospital at a given time on a daily basis. And I know a lot of people have been watching that, just trying to get a sense for what's happening in between these calls or in general. And that can be very misleading, because in the past we've been reporting it on, and many people have been watching our status on a day-by-day basis. And without a trend, it's really hard, and with what we call the tyranny of small numbers, it's very hard to discern just by looking at daily numbers of patients in the hospital or in the tent or in the emergency department, what the actual situation is with our ability to handle patients. In other words, what our capacity is to be able to take care of COVID patients in the event that those numbers start to increase. So we worked with public health, and Charlie is on the call today, to develop a table that is a snapshot of where we are at any given time with respect to our ability to take care of patients, of COVID patients. In other words, if our capacity starts to diminish, we're going to become cautious. We're going to say we need to be careful that we're not allowing this virus to spread too much and start to take up too much of our capacity here at the hospital. And if it gets bad enough, we're going to be very concerned, and we're going to be expressing that through this information to public health to consider whether or not additional measures are needed or if they need to make any changes. So the far right-hand column is what we'll be updating whenever something changes. And as you can see right now, our current status is that we're comfortable in all 3 of the categories that I'll review, that we've got plenty of capacity. And you can see in the column immediately to the left, the comfortable column, what that means. And there are 3 different categories. Our inpatients, the number of patients. The second category is the number of patients that are coming to our outpatient services, our emergency department, our respiratory tent, and for community testing, which I described a little while ago. And the third category, as I just described, is the number of employees that we have available to take care of patients that present here that can be a constraining factor on our capacity. So in the comfortable column, as you can see, we want to make sure that we have at least 50% capacity. And if you now look at the second column to the left, you'll notice that we've actually defined what capacity means for us. And so in this case, when we say inpatient hospitalization capacity, we're noting that we have 16 beds total on our patient care unit. That's our general care unit for our patients, 4 of which are negative pressure, which is where we need to keep patients that are COVID positive or suspected COVID so that they don't spread the illness to other patients. We also have 4 beds in our intensive care unit, all of which are negative pressure. And then we have 5 ventilators that we have available, 2 of which are used for transport purposes. Now, I want to point out that when we talk about transport, that's an important consideration, because one of the things we're monitoring is the availability of beds at higher level facilities, typically in Denver, to manage these ventilated patients. And so if they start to become saturated, that becomes a capacity problem that we're going to note on this chart. I also want to just point out that we keep, at any given time, we want to keep at least 1, but likely 2 of our vents available for those transports to those facilities. All of these criteria assume a non-surge situation. We have creative ideas and solutions in a very detailed plan that we've developed called a surge plan if we need to go extend beyond all of these numbers, but these are in suboptimal conditions and operating outside our normal status, and we don't want to get there. So that's why we're noting if we have less than 25% of this capacity available, we're concerned. If we have between 25 and 50%, we're saying let's keep an eye on what's happening. We'll have a yellow cautious over in this far right column. So the next category is average daily visits, and so I won't keep explaining the different columns, but there you can see we're looking at how many patients are coming through our emergency department, our respiratory tent, and our community testing. If those numbers start to climb, we're going to be cautious, and if they get to the point where we're seeing, on average, over a period of time, more than 10 patients in the emergency department, in other words, it's sustained that our daily visits to the emergency department with COVID-like patients is more than 10, we're going to be very concerned. Similarly, 16 with our respiratory tent and 32 with our community testing. And finally, healthcare workers. We're focusing for these purposes on essential healthcare workers. So what that means is people like me can be out and it's not going to affect our capacity. People that are in administrative and support positions. We're focusing on those that take care of the patients, and in particular, those that take care of COVID patients in the PCU, the ICU, the emergency department, et cetera. So as you can see, as long as we've just got a few out at one time, we're comfortable. We have more than 10 at any given time, and for a sustained period of time, it's becoming a trend, we're going to be very concerned. And so if we end up with, in that far right-hand column, a comfortable and a cautious and another comfortable, then we all need to be, as a community and with public health, now being thoughtful about what's starting to happen with the viral spread. If we start seeing concerning in any of those three categories, we really are going to be working with public health to say what needs to potentially change to stop that trajectory and maintain our healthcare capacity. So I hope that explanation, albeit somewhat lengthy, is helpful, because if you are one of our community members that watches what's happening on the website, this is what you're going to be seeing after it goes live. I believe it's next week. And so I just wanted you to have an understanding of what this means, and we'll continue to explain this at every opportunity until we all get comfortable that this becomes our hospital capacity dashboard. Okay, with regard to testing, I'll just go through some basic points that we've talked about on this call and every opportunity heretofore as well, and that is medical testing is what's done in the hospital. We do that for all of our patients that we believe may have COVID or that we want to make sure don't have COVID, like if we're about to perform a surgery on them or they're about to deliver a baby. We don't want we at least want to know if somebody is here with COVID, with a COVID positive test result. We use both virology, which is the PCR test looking for the virus itself, typically through a nose swab, and serology, which is using blood. It's up to the physician to decide for each case what is most helpful. Almost all of the tests that we're generating are for virology, looking for the virus itself with the nasal swab. The second type of testing I've already talked about, and that is where we're encouraging everybody, free of charge to the patient, to contact their physician if they have any symptoms and be referred to our tent for a test. And in that case, we're using swabs. We have now been able to acquire some rapid tests that are still performed with a swab, but can be done in the hospital. And we hope to have those online sometime in the next month or so. And that will really be transparent to the patient, other than the fact that we'll be able to turn around tests quickly. And that's because of the very high-tech analyzers that we already had in our lab. Up until now, we just haven't been able to get the kits for it because they've been sent to high-use areas. So that's the community testing. That's the people that are coming in, and we provide those tests to initiate the process of then, for those that are positive, and it's a small percentage, they are turned over to public health and the tracers to do their part in boxing it in. And finally, we do have the ability to do targeted testing if we are concerned about a particular type of, like for example, at our Victim Terrace, if we were concerned we were having an outbreak there, we can run over there and test our patients and our staff there to keep a potential virus from getting out of control. So those are the different types of testing that we support. I've already covered, I think, community testing pretty well, so I'm not going to spend more time on that. So once again, if you have symptoms, contact your primary care physician. Your primary care physician will determine whether or not those symptoms are appropriate to be tested for COVID, and if so, refer you to our testing tent. If you don't have a primary care physician, call one of ours at 279-4111, and we'll make an appointment. So this is the results, the number of tests and the results that we've seen so far. So you can see back up until April, the week of April 19 to 25, we had a relatively small number of tests that we were performing because we were only performing them for medical purposes. But as of April 25th, or April 24th, actually, we started the community testing, and you can see the numbers started to jump up. And then on May 1st, we started also testing for patients that were going to be having surgeries here or going to be delivering a baby. But these numbers are really focused on those that were here that were symptomatic. And so, again, you can see the jump up in the testing. The blue bar is the relatively small number of patients that had positive tests. And you can see it kind of peaked around March 22nd to March 28th with pretty small numbers thereafter. This is a look, and I think this is a very interesting chart, at the cumulative numbers of negatives in the gray line and positive, pardon me, I got that backwards, positive in the gray line and negative in the yellow line. As you can see that while before we started community testing, we were just testing people that were here with moderate and severe symptoms, we were kind of equally matched in terms of the number that were coming back positive and negative. Once we started community testing, our number of tests went way up, but we really didn't see that many more positives coming through. In other words, there were a lot of people in the community with symptoms that thought they may have had the virus, and after they were tested, were determined not to, or at least not to have a positive result yet. We thought you might be interested to see this point, and this I mentioned a little while ago. We're testing patients that are coming in for surgery for their protection and that of our staff, and those that are going to be delivering a baby or having a C-section. And you can see the number of tests we started performing, really focusing around May 1st. But what's notable here, if you will, is these are all patients that are asymptomatic. They don't have symptoms. We're testing them just to make sure. And yet, as you can see, we've had 2 patients so far test positive. They didn't even have any symptoms. They were coming in for a surgery or what have you, and we tested them just to be safe, and lo and behold, they had the virus. So I hope the community takes that into account when we're talking about wearing our masks and keeping our distances from one another, because we may feel perfectly fine and be a carrier, and that's what that data represents. Okay, so overall, we've performed 293 tests at ABH, and other than those that are pending, we've had 21 positive, or a rate of about 8%. So about 8% of the people we've tested have been positive. Now, mind you, the vast majority of these are symptomatic. So it goes to show that just because you have symptoms doesn't mean you have the virus. But as you've also demonstrated, just because you don't have symptoms doesn't mean you don't have the virus. Okay, so Charlie's going to spend time talking about the 4th step, which is the tracing. That's supporting the box-it-in strategy. So I'm not going to spend more time there except to say that the testing part is so critical because that's how we start the box-it-in strategy. It's going to keep our community safe along with our individual efforts. And so I can't say enough. We don't have a physician on the call today to make their plea as the people that see these patients downstream that we have to maintain our masks. We have to stay at least 6 feet apart from one another. We have to wash our hands frequently. If we don't feel well, stay home. And for heaven's sake, if we believe we have symptoms, call our primary care physician to see if we should be tested. So everybody should become familiar with the 5 commitments, and we should all be supporting one another and making it the norm to follow these rules and to feel awkward when you don't, rather than the inverse. So the public health wanted us to remind you that if you're operating a business and you're opening, you have your business safety guidelines and making sure you put up the signage. And the last thing I want to say is, as we said at the very beginning, our hospital believes strongly that as much as we've appreciated the community's work and hard work to keep our hospital from being overwhelmed by the virus and save lives, unfortunately, we can't stay in this suppression mode. It just is going to ultimately have secondary impacts that could potentially outpace those of the virus itself. And I referred earlier to the social determinants of health. And these are the things that ultimately determine how healthy we are, and they are all being impacted by the suppression mode. So that's why I'm so glad the hospital is so supportive of the partnership that we have with Pitkin County Public Health and to support the roadmap to reopening. Tori's on the line today and was in a public Board of Health meeting where this was discussed, moving to the next phase. And we are excited to be in that process because we all need to get back to restoring our economy and our lives. So I believe with that, I am finished. If you need more information, these are the different sources you can go to get that information. I'm at this point just advancing this on behalf of public health and the hospital. And so I'm going to conclude, Tracy, and go ahead and figure out how to get out of this so somebody else can take the screen.
Yeah, I think, that's if you can figure it out, that'll be great, because I know Charlie has his presentation to share up to.
Okay, I might have to have somebody come in and help out. Oh wait, I think I'm
good job, Dave.
stumbling into it. Okay, are you good to go?
I'm good. So everybody can see those slides, I hope. First of all, I want to thank Dave for his leadership and aviation's being an important partner in managing this outbreak in Pitkin County. They've made significant contributions beyond what a typical community hospital would do, and we're very, very fortunate to have them as a partner. So thank you, Dave. I think all of us at Public Health and in the community appreciate all that you're doing. I want to start with just a little bit of history. It's always good to look back and talk a little bit about Gunnison, a town that dodged the 1918 Spanish flu epidemic. That epidemic came in 3 waves over 3 years, and there were more than 49,000 cases in Colorado and 8,000 deaths from the H1N1 influenza epidemic. Put that in perspective, in Colorado so far, we've had 23,000 cases, so about half the number of cases, and 1,300 deaths as compared to 8,000. So Gunnison at the time really feared the impact on its community of this influenza outbreak and erected barricades at either end of town, sequestered visitors. If they got off a train, they made them go right directly into quarantine, arrested violators, closed schools and churches, banned parties and street gatherings, and they just basically locked down. They quarantined anyone who entered the town for 2 days initially, and then increased that to even 5 days. And after 2 years, 2 waves of the pandemic, they didn't have a single case. But they did determine that the lockdown was causing severe economic hardship, and the flu seemed to be abating in the 3rd year in 1920, so they lifted the quarantine. And in only a few weeks, the virus found its way into the community, and they documented 58 cases and 4 deaths in the town of 1,300 people. We live in a more interconnected world today where it's not feasible to totally isolate, but history provides that suppression, what we've been doing the last month and a half, 2 months, really does work. And now we need to understand the trade-offs as we move forward, reducing the mitigating strategies and moving toward reopening our society. Everybody has seen this roadmap to reopening and understands what it means for our families, our businesses, and our visitors. So we're going to look at a little bit more at the 5 criteria that Dave talked about. And all of you will notice that the title of this slide is not the 5 criteria to keep visitors away, businesses closed, and us in the home quarantine. The stated mission of the Public Health Department includes the words, support positive outcomes for everyone. And we want you to know that we do understand that that includes a healthy economic climate. Like Gunnison in their day, our data suggests at this point in time, we have successfully achieved our objective of suppressing the natural transmission levels of the virus. And our goal now is to move from population-based strategies to individual and close contact level containment. And that's an important concept. And that will require more personal responsibility on everyone's part in order to free up the majority of our residents and businesses and begin to welcome visitors once again. Today, with each Board of Health meeting going forward and community meetings, and for the public at large, we want to share the data that we're watching so that everyone can see any sudden shift or change in these trends. Here's an advanced copy of our new community dashboard that will be rolling out next week and will be shared with everybody in multiple sites where the public can access it. It contains much of the data that we're going to review today, so we're not going to go through it line by line on this screen. The first metric that we're monitoring in terms of public health is testing. And these figures represent PCR testing at AVH and include testing of staff, pre-op OB, respiratory tent, emergency department, and community testing. And these were updated even after Dave presented his numbers to just a few more. There were a few more tests that came in. For those of you who are quick at math, the missing 16 results, are pending. These numbers do not include antibody tests performed at AVH nor primary care physician testing of any method. And we plan to add those figures on separate lines in the future. The next thing that we monitor is our sustained decrease or the stability of the number of COVID cases, over the last 14 days. And this graph shows those by date of onset. So some people may have seen in various sources that there have been cases more recently reported, but those onset dates were actually back in early April. They were serology tests for the most part. And when we've done the case investigations, we found that those infections actually started over a month ago, or a month and a half ago almost. So we have no current outbreaks or unrelated cases. And by unrelated cases, I mean that if we get cases that are in groups, like in a household, we can control those more easily than if we have cases popping up all over the county. Another metric that we look at is self-reported symptoms of influenza-like illness from all of you in the community. And we would encourage you to continue to enter information into our symptom tracker, and it helps us kind of monitor if you haven't been able to get tested, whether you're feeling some type of symptoms out there. And we're monitoring this similar kind of data from Garfield and Eagle County, which shows a similar picture of a large cluster of cases of people feeling influenza-like illnesses in the March to early April timeframe, and then not much over the last month and a half. So the next metric is decreasing or stable cases in our adjacent counties in Colorado. We live in an area of the Roaring Fork Valley where people move about up and down the county for jobs or for recreation or to visit restaurants. So it's important for us to know what's happening in Eagle County, particularly the El Jebel side of Eagle County, and what's happening in Garfield County. So for us here in Pitkin, the total number of cases and the cases we saw this week on May 19th, for example, we compare that to a 7-day average in order to determine whether or not things are we're at a stable or decreasing or increasing type of situation. Pitkin County right now is stable. We didn't have any cases on May 19th, and our normal cases have been 1 or 2 a week, or none at all. Eagle County trends are stable as well. They have had an outbreak in a long-term care facility, but otherwise report mainly household transmission. And Garfield County is stable as well, with no one currently hospitalized for COVID at Valley View Hospital. And we don't have any currently hospitalized at AVH for COVID as well. Cases in Colorado are actually decreasing as well. They still reported 280 new cases on May 19th, but the 7-day average has been well over 300. So they are actually on a decreasing trend. The only troubling reports that we've heard that we're tracking in terms of data are that worldwide cases are increasing, and that as all 50 states are doing some degree of reopening, the data is not in yet, but we are seeing some increase in cases, particularly in southern states like Georgia and Texas. So the next thing we want to do in terms of monitoring data is kind of look at some big data kind of picture to relate any increase in cases. This graph shows our traffic count going over the bridge and compares 2020 to 2019. And we're starting to bring those two graphs back into congruence. In fact, we got some information today that we're now down only 7% versus 2019. So we're going to be seeing those traffic circle backups again. And then here's another interesting graph that shows mobility of our population. And this is of Eagle, Garfield, and Pitkin County, and it's tracked by cell phone data. And you can see that early on we had a decrease down, from in the February-March timeframe, and then since that time, particularly in April and May, we've started increasing our movement quite a bit. And we're still working on some other big measures, big data measures like this. We're looking at building permits, airport passenger traffic, restaurant and bar activity, and lodging occupancy. And the goal here is to know where, when we do get new cases, that we could kind of track some of these big data kind of things and as to where they might be coming from. So then I want to switch gears a bit from the data side, that was more the epidemiology side, and talk a little bit more about the box it in strategy. And you're all, I think, pretty familiar with this in terms of, our plan is in terms of moving away from big population suppression to moving toward identifying individuals that we can test and isolate, talk to them about who their close contacts have been, contact those people and quarantine them, and in order to put a box around any potential spread of virus. So as you might expect, we're also looking at measures that we can do around that strategy as well. So the first metric is, can we get all symptomatic patients identified and tested within 24 hours? But this is a very difficult thing to measure because it involves, we don't know who's symptomatic unless people step up and tell us. And this is where some of the individual responsibility comes back in. We can amplify our public messaging to you and work with employers to make sure that employees are being screened and encourage them to get tested. And as our airport gets busier, we can have education and screening processes in place to safely bring visitors back into our community. So as I was saying, our goal is to identify and test 100% of symptomatic people. And the reasoning here, and as this chart shows, the reproducibility number for this virus is that about 2 to 3 people are infected for each new case. Our suppression activities have reduced that reproducibility number to closer to 1. So we've interrupted a lot of the transmission that has been happening. We can reduce that even further with this boxed-in strategy and get it below 1, which creates more of a buffer between our hospital capacity and the number of cases that we might see in the community. So recent studies have shown that we can reduce the effective reproduction number by 45% if we identify and test 90% of symptomatic individuals and quarantine and test 90% of their contacts. That figure falls to 10% if we only identify and test 50% of symptomatic individuals and 50% of their contacts. So our task from the public health side is to increase this robust box-it-in strategy with contact tracing, testing, and quarantining in order to reduce that reproducibility number below 1 and to create that buffer we need to reopen various aspects of our society. Another metric is that PCR testing results can be done, and the results can be obtained in 24 hours or close to that, 48 at the absolute maximum. If we have to send things off to a lab, that can be sometimes take 2 or 3 or 4 days. So as Dave talked about, there are strategies for the hospital to do more testing and to bring that turnaround time down. Our challenge in public health is, as we are implementing the box-it-in strategy, is whether to isolate and begin contact tracing for people who report symptoms when we don't have a test result yet. So this becomes an important aspect of the success of our program going forward. The third metric of public health is that all cases are interviewed for contact tracing if we do get that positive result. And as this graphic shows, it kind of walks you through, a person is infected, there's an incubation period of about 2 to 14 days. Most often they show symptoms in 5 days, but it can take up to 14. So assuming that it's going to be on the shorter end of things and people are most infectious when they start showing symptoms, we have a window of opportunity when that first infected person might infect another person that was a close contact. If we can find out who those close contacts are, we have that 5-day window of opportunity to put them into quarantine and prevent them from infecting the next person. So we can interrupt this chain of transmission. The fourth metric for public health is that all positive cases and contacts are isolated and quarantined. And that seems like not that difficult to do if somebody's identified. we're going to call them up and issue an isolation letter or a quarantine letter. But there's a lot of technology and process for that. And some people are going to need support beyond just a letter that said, you got to do this. They may have people at home that might be at high risk. So we might have to find alternative housing for them. We might need help getting groceries or prescriptions. So we've built that into our scripts as well. And the county has made commitments to help people that are isolating and quarantining, because their sacrifice is helping all of us in terms of preventing this transmission of the virus. Our fifth metric is that all of those isolated and quarantined individuals actually follow through and stay quarantined and isolated. So most oftentimes it's easiest for the person who makes the first contact with them to follow up on them over the next 10 days and ask if they're doing okay. If they're a contact, whether they've developed any symptoms, and at that point we would have them tested and they would go into isolation as opposed to quarantine. But we need a staff to do that. So the county is committed to hiring additional staff to do follow-up on all the contacts. Our goal is to add a barometer of sorts to the dashboard to monitor how many individuals are in investigation, isolation, and quarantine. As of today, it's very few. We have a team that's trained and ready to be deployed, but there isn't a lot to do just yet, which is a good thing. So that's where we are in terms of our EPI, in terms of our healthcare, in terms of our public health preparedness, to be more surgical or individual in our process for further containment, rather than blunt or population-based in our response. And as I began today, we understand that health involves more than just whether a person is infectious or not infectious. The majority of our population is not infectious, but remains susceptible as opposed to immune. So we have the opportunity right now to focus on these other determinants of health while we have the virus somewhat contained in our local area. And we're anxious to do that. And finally, I'm going to leave you with a slide that kind of puts the COVID epidemic in perspective. If you look back at the Black Death or bubonic plague of the 1300s, 200 million people died in that outbreak. Smallpox, 56 million. Spanish flu, 40 to 50 million. The plague of Justinian, that has been credited with hastening the fall of the Roman Empire, 30 to 50 million. AIDS, HIV isn't even on this list. They were in the 25 to 35 million. COVID is way out to the right here in terms of the size of outbreak. I only bring this up to say that, we will survive this, we will get through it. And our steps for managing this COVID epidemic has been to reduce viral transmission with suppression strategies, which we've done, to follow up with aggressive case containment through our box-it-in strategy, which we're doing, to closely monitor our data to be sure that cases are less than healthcare capacity, which Dave talked about, and we are closely monitoring, and to follow the roadmap now to a greater level of economic health. So with that, I will stop sharing my screen and turn it over to Mayor Tory.
Charlie, thank you very much. Dave Ressler, thank you as well. What you just heard from these two gentlemen, Dave was bringing you the information about the data and the hospital and our medical preparedness. And then Charlie was giving you a little insight into how we apply that data and some of our strategies moving forward. And thank you both for that. I'm going to talk about a little different thing, and that's a little bit about what we each can do. And the first thing I want to say is welcome to everybody that's on this community meeting. Thank you for taking your time to learn more about the situation that we're in right now and what we're going to be doing going forward. Wishing everybody health, safety, and of course some sanity in these very difficult times. I am joining this call a little bit late because I was actually on the Board of Health meeting just a moment ago. So just to let everybody know out there that we are still on target for some of those reopening measures that we are looking to do. They will, of course, depend on the data that we get even from the next 6 days. And with that, what I want to say is we all have our part to do. So no matter who you are, the businesses, the residents, the visitors, we are all one community. So far, this community has stepped up amazingly, but we need to maintain that level of cooperation. As you're out in the community right now, you can see the businesses are doing it. So many businesses are operating under very difficult conditions and really stepping up with safe practices. They're doing it, but they need us to do it as well. When we are visiting these essential businesses, when we're interacting and we're having contacts out in public, we need to be conscientious and respectful of each other. And right now I want to talk about the 5 commitments that we're all being asked to make, and hopefully all of you are aware of these and going to take your part in them. Number 1, the 6-foot distancing. And why is 6-foot distancing important at this time? Well, we do know that some of the transmission is from breath, from moisture in your breath. So that 6-foot distancing is just a way to keep others safe and to keep yourself safe as well. Washing your hands. One of the greatest things you can do because of how we live, all of us are in contact with different surfaces, maybe exposure to the virus. So washing your hands, that way you're not going to be transmitting it to yourself by touching your face or to others. So again, washing hands, as simple as that sounds, and as long as you've heard that for your entire life, very important. Clean hygiene is very important in this. We are asking that face coverings, commitment number 3, face coverings, and not just for your own health, but the health of those around you as well. This is, again, one of those small commitments that we're asking everybody to make. Wearing face coverings as you're out in public, not able to do that 6-foot distancing, or if you're visiting some of those businesses that are open for your pleasure, please be respectful of the people that are working there as well. And of course, if you're not feeling well, just simply stay home. And if you need anything to get you through that difficult time of staying home, there are a lot of resources for you. If you're in need and you want to stay isolated, please go on to pitkincounty.com. There are many resources there to get you any of the services or goods that you might need in your isolation. We are here for you. And lastly, of course, if it comes to the point that you're feeling symptomatic and you're having a fever, the chills, any of those types of symptoms, get tested. Get tested as soon as you can. That's going to allow us to identify you, whether you're positive or negative, and then we can protect those that have been around you as well. So if you are feeling some of those, please do get tested. Testing is available and very available in our valley now for those that are symptomatic. Again, I want to refer to those businesses, residents, and our summer guests that are already showing up in town. So as I said, businesses are doing their part. They're laying out the best safety protocols that they can, but it is up to us, the residents, to model some of that good behavior. As we're welcoming these visitors into town and our summer guests, we need to show them that we're leading by example and keeping us as safe as possible. As I said before, we are moving to more relaxed restrictions, not quite yet, so please maintain these 5 commitments, not just through this weekend and as we move towards reopening, but as we start reopening as well. If we all keep working together as we have been, and we encourage others to be conscientious and respectful, we can have a safe and successful summer. I just want to take a moment for a little bit of levity in this situation. All of us have been under a lot of duress, but through these even these video meetings that we're having, we're coming closer together as a community. We need to maintain that support and that respect and that willingness to work together. We've had a glimpse into individuals' lives, if you will, through these video meetings. You can see the musicians that are out there that have some of their instruments hanging in the background. You can see the art or the books or those people that like to have their meetings on their patio or outdoor. Or for me, I learned about Charlie Spicker that he uses that treadmill in his office to maintain that well-managed physique that he's been working on. Just these kind of things are the things that are going to keep our community together through this difficult time. Make sure that you're reaching out to your loved ones, your friends, your family, your neighbors, letting them know that you're thinking about them. We're getting through this, everybody, and we're getting through it very well. We're going to be safe and successful as we get into this summer. I do want to just say that, you know, we have seen, as Charlie was referring to, the traffic counts are coming back up. We have seen through the Colorado social tracking mechanism that, you know, perhaps in Pitkin County, we are a little bit more socially moving than others might be. It doesn't take much to just go out onto the streets of Aspen and see how people are handling this pandemic right now, whether they're wearing masks, whether they're staying socially distanced. We still have work to do, guys. We are still all in this together, but together we are going to come through this stronger than ever. Those are my messages for you tonight, everybody. I want to thank everybody that's been working on all of this from all sides, out at the hospital to here in the county and the city. We are here for you. If you need more information about COVID and coronavirus, please go to pitkincounty.com, a great source. Whether you want to volunteer, need help, or just need some information, pitkincounty.com is where you want to go. And I, of course, always available for you, Tori at cityofaspen.com. Feel free, write me an email, any questions, suggestions, or just to share your frustrations. I'll be happy to call you back as well. For now, everybody, that's what I've got for you. We're working hard. We're headed in the right direction, but let's stay together through this. This is definitely a collaborative effort for our entire community. With that, I'll turn it back to Tracy if she wants to say any last words. I just wish everybody the best out there, and stay healthy, stay safe, stay sane, be well.
No, thank you, Tori, and the panelists again today. We always appreciate your commitment to coming out here and providing information to the community. I'd be remiss not to thank the GrassRoots team and the county IT team that keeps us on track with these when we pull them together. I love what you said about how we're learning a little bit of flavor of each other, right, through Zoom meetings, but it's a pretty cool thing. So again, we'll see you again. We'll let you know if we'll be back next week, or if we're gonna start kind of trying to put Board of Health meetings one week and then the community meetings the next week. So just keep staying tuned to our public health Facebook page or the Pitkin County website for those updates. Thanks again.